Thanks for keeping it tuned here to the Mountain Morning Show on Park City Television. Right now I'm excited to be joined by Dr. Michael Kagen. He is a board-certified internal medicine physician as well as a primary care physician using an innovative healthcare model called direct primary care. Dr. Kagen, how are you doing today?
Great. Thank you for having me on.
Thanks for coming back here to the Mountain Morning Show. We really appreciate it. So let's talk a little bit more about direct primary care. What is it exactly, and what are the benefits that come along with that?
Great. Yeah, so it's an innovative model for practicing medicine. It's been around for 15 or 20 years, but really in the last 4 or 5 years, it's gained a lot of traction. So we see thousands of physicians that have transitioned over or are transitioning their practice over to a direct primary care model. And so what it is it's a medical model that has taken insurance and bureaucracy out of the equation and left only patients and physicians. Okay. So physicians work directly for the patient, and it really restores the patient-physician relationship.
And what do you think what does this change about the patient-physician relationship where you don't have that middleman that would be the insurance company kind of in between the transaction?
Yeah, so you have a direct relationship with your physician. So if there's any issue that arises, you contact your physician directly and address whatever needs to be done. You don't have insurance companies dictating what needs to happen before a certain test is done. You and your doctor decide what that is going to be.
And the unfortunate thing with insurance, and as I think you hit the nail on the head, is it gets rid of the bureaucracy of the insurance.
Right.
You typically have to jump through 17 different hoops just to get an x-ray scan, just to get the cost of certain small things covered. Right. And it could take weeks of preparation just to get that taken care of. Some of us don't have that luxury of time, or some of us just don't want to deal with that headache.
Right. So prices are actually a lot more expensive when you deal with third parties, when you go through your insurance to pay for something, and also it takes longer as well. So when you cut out the middleman for medical practices, you're lowering your overhead costs by a huge margin, and you're able to pass those cost savings onto your patients.
So how does this all work? How do you become enrolled in the direct primary care? How do you become a part of this whole network?
Sure. So in my practice, I have a monthly membership subscription. So in my practice, we use age-tiered pricing, and it starts at $250 a month. What's covered is unlimited office visits, unlimited urgent care, direct access to your physician anytime that you want to access your physician by text, email, video, however you want to access your physician. And office visits sometimes don't need to happen at all. If it's something that can be handled over the phone, we don't need to bring you into the office to bill your insurance company. We can do what's most convenient for you. On the other hand, if you have something that really needs to be addressed, we can have an extended office visit, up to 2 hours in length. Wow. And get to the root cause of what's going on. So
it seems to me like this offers a little bit more in-depth medical care to the patient. It seems like it's a little bit more tailored to their needs specifically, and it seems like you're getting a little bit more in-depth care from your primary care provider.
That's exactly right. You're getting the preventative care, primary care, urgent care. Every point of care is covered by your doctor. So you have your doctor all the time. That's amazing.
And what are some of the benefits you think that provides to patients being able to see not only the same doctor on a regular basis, but have maybe that personal connection and a connection with your doctor?
Yeah, well, that's what's most important, is having that personal connection with your doctor, that if something is going on, that you're being proactive about it and getting it addressed immediately, rather than waiting weeks or months to see your doctor.
And this may sound silly, but I think it's a real factor, and I think that a lot of the time people have a hard time being honest with their doctor about maybe some of the things that they're feeling or some of the things that they're going through, because they're afraid of maybe a stigma that may come along with that, or maybe they may feel afraid of having to open up to someone like that. So being able to connect with your doctor on a personal level in that way also provides a benefit on kind of an emotional level of healing as well.
Absolutely. Well, it's very important to have that rapport with your physician, that you can communicate any concern that you have. It's also hard to communicate concern in 8 minutes. So if you're going through your insurance and you're seeing a physician who's seen 30 patients a day, it's really hard to address any complaint that you have in that very limited period of time. I know as a physician, because I've worked in a large clinic for 3 years, and it's very frustrating for me not having that time to listen to my patients, because having that time to listen is really what leads to a diagnosis. It's a lot of history taking. So if you don't have time to listen, I can't do my job well.
And I think I want to get back to something that you said too, as well as really taking the time to get to the root of the problem, rather than just maybe masking the problem with either more medication or something that's going to provide more side effects. It's nice to know that there's also the option to figure out maybe the root of the issue to solve that as well.
Absolutely.
Which is a major thing there. So let's talk a little bit about some of these services that are offered through your direct primary care. You also offer some specialization services as well, like skin care or skin cancer screenings.
Yes.
Let's talk about that.
Exactly. So we have the region's only Photo Finder ATBM, which is an automated total body mapping device.
Yeah.
And it's actually the best in the world for skin cancer detection. So what the computer is equipped with an artificial intelligence program.
Wow.
And what it's doing is comparing an image of your skin from one point in time to another point in time, and alerting the physician if there's any changes to existing skin spots or if there's new skin spots that need to be examined. And it also analyzes dermatoscopic images, so microscopic images of the skin, and it helps give a second opinion whether or not this is something to be concerned about.
So a more accurate diagnosis of whether this is skin cancer or not skin cancer, as we know that it can be a very hard thing to diagnose. And here in Park City, I think it's an important thing to have, because we are such an outdoorsy community that spends a lot of the time in the sun, outdoors. This is something that is a great thing to have here. What else? What are some of the other services that you guys offer?
So any office-based procedure is included in the membership fee. If it's an EKG, spirometry, biopsy, cryotherapy, suturing, anything that's simple that I can do in the office is included in the membership fee. We also offer white glove service. So if there is a concern that you have, you communicate directly with me, your physician. But also, if you need to see a specialist, I communicate directly with the specialist on your behalf, and also arrange your appointment on your behalf as well, if you would like me to do that. So if you're a member of my practice, you never have to call into a phone tree to schedule an office visit. That's taken care of for you.
I'm sure for so many people hearing that, not having to sit on the phone for 30 minutes to make an appointment, not to have to handle all the logistics of the insurance is a major thing there. We're going to take a very quick commercial break, but when we come back, we're going to talk about how you can actually get involved and enrolled in this program here, Direct Primary Care with Dr. Michael Kagen. We'll be right back. Don't go anywhere. Welcome back here to the Mountain Morning Show. We're continuing our conversation with Dr. Michael Kagen about his direct primary care over at his over at your place here in Park City. Thank you so much. Continuing our conversation here, we're talking about the flexibility of direct primary care and the way that it can really be tailored specifically to the patient. So let's talk a little bit about the pricing, about how people can get involved right now. So what are some of the prices that differentiate between insurance and direct primary care? Yeah, so
I've negotiated cash prices for basically any medical service that you can think of. If it's labs, imaging, a home sleep test, so really colonoscopies,
anything,
genetic testing, pretty much anything has a cash price to it. You can't see it when you're going through your insurance, because if you ask your insurance, if you ask whoever's providing this service, they have to ask you what your insurance is and what your contracted rate is with that insurance. But through my office, my patients have a crystal ball where they can see the transparent prices for any medical service. So let's have, you said you had an example of one of those prices, this difference between insurance and cash. So what is that example that you have? So let's say you have a ski accident and you've twisted your knee. You might have a torn meniscus in your knee. And so an MRI is recommended. I can get you the MRI with the radiological interpretation for $350. Whereas if you're going through your insurance, you may pay 10 times that price. I don't know if, the camera wasn't on me, but my eyes literally went huge, because I snowboard, I skateboard, I've gone through these experiences before, and I can't believe you could get an MRI for $350. Yeah. That's amazing. Yep. Wow, that I cannot believe that. So this is maybe just one of the benefits that comes along with being enrolled in a direct primary care model. How can people get involved with that? How do they get involved? So they can visit my website, kagenmd.com, and give me a call, 435-MD-DOC-MD, and I sit down and explain my service to people and see if it's going to be a great fit for them. and if it is, I enroll them.
I think one of the best things about this program, honestly, throughout this whole conversation we've had is just how flexible it is. I mean, it really molds itself to the patient, which I think is what healthcare should be all about, right? I mean, it should be about the patient. That's what the whole industry should be about. And unfortunately, it seems like it's kind of strayed away from that. Politics and bureaucracy tend to do those sorts of things. But this model is offering kind of a healthier alternative, I guess you could say, to the healthcare model that we have in the United States right now. And it's so flexible. Let's talk about how people can get enrolled in the sense of billing. You said that they can be billed monthly, quarterly, annually, whatever works for them, as long as they're enrolled for a minimum of 3 months.
Right. The minimum enrollment period is 3 months, but you can leave the practice at any time with 30 days notice. So whatever works best for you. I aim to build lifelong relationships with my patients. I've had very, very few people leave my practice. So people join, and the plan is to see them for a very long time.
I can see why, and as you said, you specialize as a primary care physician, so being able to go back to the same person who knows you, who knows your body, who knows your health, is a wonderful thing. It's gonna benefit you in the long run.
And I specialize in internal medicine, which is it's tailored towards adult care. Adult
care. So long-term adult care, so through your whole adult life, which is amazing. Let's also talk about the fact that I think maybe one of the barriers to enrolling in a direct primary care network for someone who's in an insurance network right now is to say, what if I travel? What happens then? What happens if I'm in Colorado? What happens if I'm in on vacation in Florida and I get hurt?
Right. So I've networked with physicians around the country with similar practices. So members of my practice, if they're traveling abroad anywhere in the United States, right now just in the United States, but we have a network of physicians, concierge physicians, that can get you in and see you in any major city in the United States.
So in essence, there is a network like an insurance network, not exactly like an insurance network, but in the sense that you guys are working together as concierge physicians to provide the same direct primary care all across the country to a myriad of patients.
Right. The goal is that we want to offer the same white glove service to visiting visitors as we do to our own patients.
That's amazing.
Yes.
That's amazing. So what barriers do you have to get signed up? I know this is something that I'm definitely going to look into a little bit more. Let's talk about where you're located here in Park City, where people can visit you, and then one more time with your website.
Yeah, my office location is right next to Parley's Park Elementary, so right across the street from the 7-Eleven Blue Roof Market. And my website is kagenmd.com. You can give me a call at 435-MD-DOC-MD.
Perfect. Dr. Michael Kagen, thank you so much. I really appreciate it for educating us on direct primary care and how flexible the program really is. If you want to find out more information or to get enrolled, head over to Dr. Kagen's website, kagenmd.com. We'll be right back with much more right here on the Mountain Morning Show. Don't go anywhere.